Hi everyone. Now we are going to discuss about the topic MCQs on disorders of memory. So before that, let us see what is memory disorder. So memory disorder is a disorder which is characterized by impairment in recalling or retaining or processing information, or memory disorder is a disorder that affects the ability to remember information, and this memory disorder which is caused by damage to certain parts of the brain. And here we know types of memory disorders also: amnesia, dementia, memory impairment, delirium, mild cognitive impairment, false memory syndrome, etc. So now let us see questions one by one. Confabulation is a disorder of perception, thought, memory, mood. So confabulation means also called memory error or disorder of memory. Here the person generates false memories. Here the person generates false memory called confabulation. Then it is a disorder of perception, memory, thought, mode. The answer is memory. Then all are true about Ganser's syndrome except. All are true about Ganser's syndrome. Appropriate answer: apparent cloud of consciousness only found in prisoners' hallucination. The answer is only found in prisoners. So remaining giving inappropriate answer: apparent clouding of conscious, hallucination. So these are all the symptoms of Ganser's syndrome. And I tell you simple definition of this Ganser's syndrome. It is a rare dissociative disorder or nonsense syndrome. If the person giving incorrect answers to simple questions. If the person giving incorrect answers to simple questions, called Ganser's syndrome. Then next, third question. Psychogenic amnesia is characterized by antegrade amnesia, retrograde amnesia, both with confabulation, patchy impairment of personal memories. The answer is retrograde amnesia. Already we have discussed amnesia is classified into two types: antegrade amnesia, retrograde amnesia. Antegrade amnesia means if the person has the problem to form new information, called antegrade amnesia. If the person has the problem to recall information, called retrograde amnesia. And this is caused by brain injury. And this psychogenic amnesia always linked with retrograde amnesia. Sudden loss of personal memories due to stress or traumatic events, called psychogenic amnesia. Then next, fourth question. 60-year-old man had undergone cardiac bypass surgery 2 days back. Now he started, remember this, forgetting things and was not able to recall names, phone numbers of his relatives. What is the diagnosis? Depression, post-traumatic psychosis, cognitive disinfection, Alzheimer's disease. The answer is cognitive dysfunction. Cognitive dysfunction, impairment of person memory, impairment of person attention, and impairment in problem solving skills, called cognitive dysfunction. Cognitive dysfunction. The next question. Deja vu is seen in temporal lobe epilepsy, normal person, psychosis, all the above. The answer is all the above. So these symptoms we can see in the temporal lobe epilepsy, normal person, psychosis. If the person has already experienced feeling to new situation or to present situation, called deja vu. If the person has already experienced feeling to the new situation or present situation, called deja vu. So these symptoms we can see in temporal lobe epilepsy, normal person, psychosis. Then next one. Disturbances of orientation, memory and intelligence is present in which of the following condition? Organic psychosis, functional psychosis, hallucination, phobia. The answer is organic psychosis. This psychosis classified into two types, organic psychosis and functional psychosis. The exact meaning of psychosis is disconnection from the reality. Disconnection from the reality called psychosis. And organic psychosis means if the person has psychotic symptoms like hallucinations or delusion because of physical or biological abnormality in the brain called organic psychosis. Functional psychosis, here also the patient have these hallucinations and delusion, but this is not because of physical abnormality or biological abnormality in the brain. So this is because of physical or biological abnormality in the brain. Then, so here disturbances of orientation, memory and intelligence is present in organic psychosis, not in functional psychosis. So this is about the disorders of memory. Confabulation is a disorder of memory. All are true about Ganser syndrome except only found in prisoners. So this is not a true statement. Psychogenic amnesia is characterized by retrograde amnesia. And here the patient started forgetting things and was able to recall names and phone numbers of relatives. Cognitive disinfection. Déjà vu is seen in temporal epilepsy, normal person psychosis. Disturbances of orientation, memory and intelligence is present in organic psychosis situation or condition, not in functional psychosis. This is caused by brain injury and this is not caused by brain injury. Thank you all.